Hello, I'm Benjamin Miss, and this is Introduction to Psychology, Personality. The last thing we viewed was a discussion of the marshmallow task and how this relates to motivation, the ability to delay gratification, emotion, and personality. It's not always easy to define and understand these things, but what we can do is look at how people behave in various situations to get an idea of things like personality. Well, people have been trying to understand personality for as long as we have records. And if we go back to the ancient Greeks, they first defined personality using humors. In the same way, they defined things as, remember, their view of the elements was earth, fire, air, and water, right? So they saw kind of everything as a combination of these major elements. They liked that number four, and they wanted to have personality be the same kind of thing, right? So they had these four humors to describe how people were. Now, describing people in various categories in terms of their behaviors is quite interesting and quite useful. But this has nothing to do with humors or this idea of your, components of the body, right? Um, Even so, we do know that there are certain things that can affect us. So it's been a long road. Next, we look at the history of phrenology. Okay, so this is from an early phrenology text. Franz Gall believed that you could feel the skull, like so, feel the shape of the skull, and like, oh, there's a little indentation here, a little raised area here, and that meant that the person had an idea, had strong, a strong area there, right? So you could see if someone was going to be a criminal, if they had a raised area in the thieving section or a reduced area in the morality section, So they believed simply by feeling the skull, they could detect this. Now, this isn't a terrible idea. And the reason for that is when we get good at something, there are changes to our brain. And Gall believed that, he inferred that. But the changes are not visible through the skull, right? They don't have such a great change or such great influence that it influences the shape of the skull. And phrenology was a victim of the small n problem, which means they had a small sample of all of these different things. If you were to take any five people, you could find characteristics that those people have in common. You could also find areas where their skulls had similarities. This doesn't mean that you could then feel other people's skulls and it would tell you about those things. It's simply chance. It's simply when you have a small sample, you're going to find some commonalities unique to that sample simply by chance. So we're going to be looking at modern views of personality and how personality develops and personality disorders. And we also want to look at how we can assess traits and address these personality issues, right? So, for instance, we start by defining personality, right? And personality is the sum total of long-standing traits and patterns that influence typical ways of acting, thinking, and feeling that makes each person different from other people, right? Now, you can share personality characteristics, but there are things that are going to make us, in regards to our beliefs, our thinking, similar or different to other people. So when you look at what your personality type is, we have to look at a lot of characteristics and a lot of factors. We're also going to look at different types of theories in terms of trait and stage. So trait theories are basically, these are, I think, are the most, I would say, modern, valid type understanding of personality, where we can give you some personality tests and see about those traits that you have. Stage theories are more about how these things develop, right? How do we develop personality? And it's really hard to see the link between those things. There are some you can absolutely look at, for instance, early predictors of extroversion and introversion. But for most characteristics, there's very little to see in terms of development. We look at in terms of you know description theories versus explanation theories, description is a lot easier to understand than explanation, right? In the same way, we look at continuity and change. When you describe something, you're simply looking at the characteristics. When you're trying to explain it, you're looking for some, reasons for it. What I'd like you to do is take a minute to pause this and to fill this chart out. And later on, we'll look at how these things are. This is adapted from other work. It's a very, very small and completely not valid test. Probably more valid than like a social media test or nonsense like the Myers-Briggs that is just based on some cool Jungian ideas that aren't valid, but people believe it. But a 10-question test isn't going to do much. But I want you to do this because when we relate things to ourselves, they're easier to understand. And this is going to be related to a pretty good model of personality that I think we should be aware of. So let's look at when we talk about explanatory versus descriptive theories. All right, so we're going to look at these explanatory theories: psychoanalytic, humanistic, and social learning. And then later look at trait theories, like what are the components of personality, and for instance, the 5 basic dimensions of personality that are generally considered to be a good way of looking at it. So we're going to go through each of these, but we kind of get an idea. So we say that, the psychoanalytic theory, when we hear psycho, we think, okay, this is going to be something related to Freud, selfish instincts, these mental battles, humanistic theory, which is this positive drive for potential, and then social learning, which is kind of a neutral view of things. So we'll consider these first, the psychoanalytic, humanistic, and social learning, these explanatory theories, and start with Freud. So Freud was influenced by medical-based psychology. He was a physician first, and his interest was in, therapeutic methodology. And he wanted to help people, right? And so he looked at what, these causes of these things were. And he saw one of the useful things that Freud saw quickly was that telling people what their problems were, it didn't help them, right? Like the knowledge of what their issues were wasn't able to lead them to solutions. Like you can't just like diagnose somebody and be like, okay, you have bipolar, good luck. There's treatments or other ways to help people that go beyond simple knowledge. And Freud saw this as a much deeper issue. That's where we get into the ideas of the unconscious, and we'll talk about those. So he was privy to this case that he believed was conversion disorder. And it does sound a lot like it. And this is the case of Bertha Pappenheim. So Bertha Pappenheim cared for her dying father and developed these very strange symptoms, including paralysis of various body parts, loss of the ability to talk. Symptoms would come and go. She would have hallucinations of skulls and snakes, lose coordination. And then the physician she worked with, which was not Freud, but somebody who Freud was aware of and shared the case with him, she recovered and then called the doctor one night having an imaginary birth of his baby. Now, the doctor believed that, these complicated feelings, and he had feelings, complicated feelings too, and he terminated treatment and transferred her to another doctor for treatment. And Freud theorized that she had developed strong sexual feelings for her father because, good old Freud, and while she was caring for him, and transfer those feelings to her doctor, right? So Freud's very looking at, what's the cause of these things. But there were a lot of other issues in there too. One, she was treated with morphine, which is not a good treatment for, disorders. Became addicted, ended up in a hospital. But, later in life, she managed to kind of get things together and did some good work in helping unwed mothers, illegitimate children. And there was a slave trade sending Jewish girls to South America that she got involved in stopping. So very positive ending here. And one of the issues too that we want to consider is, remember, Freud's view of sexual feelings of a child for an adult. He believed these were, fantasies, and denied the common existence of abuse, which was one of, really, I would say, the greatest fault and crime of Freud was denying the validity of abuse. Now, Freud took cases like Bertha Pappenheim in building his theories. And Freud viewed 3 levels of consciousness. So this is a nice image here we see, and it's going to help us to understand how these things fit together, right? So the conscious is what you are aware of. What are you aware of right now? Now, there are plenty of things that you are able to bring to mind. These are simply things that could be conscious. This is your preconscious. So anything that you know but you're not thinking of right now is your preconscious. Your unconscious mind, according to Freud, are these primitive instinctual motives, memories, emotions that are threatening to the conscious mind and have been repressed for some reason, right? Basically, you don't like the feeling, you don't like the memory, and so in a way we deny these things, according to Freud. That's the unconscious. Now, again, it's a very cool idea because, especially given the history and the time period of, hey, things are affecting us that we're not aware of. Absolutely. Absolutely. Right. Freud took it to an extreme, but we look at how this lines up with things like the id, ego, and superego, right? The components of the mind and personality, according to Freud. So id was this drive, right? Life and death instincts, what he called libido, the pleasure principle, right? The idea of daydreaming and fantasy. Id is what you want, right? And this id drive is to get your needs met. So you want what? You want food, you want stuff, you want sex, and your id wants these things, right? However, you can't just go and take things in a modern society, right? So we have an ego that is the way the id gets its needs met in socially acceptable ways, right? So how do you go about getting need for, love, relationship, sex, food, shelter, all these things met, right? Through socially acceptable ways. And the superego is Freud's view of the conscience, right? So it's basically morality as taught by parents and society. Freud believed that you needed this teaching. Some other ideas from Freud include things like defense mechanisms. When the ego is threatened, when your sense of self is threatened, you have some mechanism to protect yourself, right? So to Freud, a fragile ego or a weak ego would have someone using a lot of defense mechanisms to protect themselves and defend their ego. And some common ones are displacement, right? So you have this aggressive or sexual feelings or energy directed away from the primary object toward something else. This would be somebody who hates their job, hates their boss, and goes and gets into bar fights to take out this aggressive energy. That's how Freud would view kind of a classic example of his idea of displacement. Sublimation is the idea of taking something that's negative, like some kind of aggressive energy, and putting it into something positive. So you have this desire to destroy things, and so you garden. But again, this is Freud's view of humans are terrible, and everything we do that's good has some kind of dark underpinning to it, right? We're doing good things because of this darkness. Identification is our tendency to be attracted to individuals who are successful in gaining satisfaction from life, who appear to have successful and happy lives, and we want to be like them. And this could explain a great deal of social media. Why do we attend to these people who, spend hours getting the perfect picture in order to pretend to have the perfect life, right? We certainly do pay attention to these things, even though it's fake. It's all fake, right? But in some way, we want to identify with these ideas, according to Freud. Now, Freud also, and this was mentioned before, but in this early kind of idea of Freud's psychosexual stages of development. So one of the first descriptions of personality and how we develop personality comes from Freud. And these are the 5 stages: the oral, anal, phallic, latency, and genital stages. So basically it works like this. Freud, sexualizing, children, says that, okay, they're gaining pleasure in the same way that we gain sexual pleasure. They gain pleasure in some way from different things. So the first stage, they put things in their mouth. Everything is, putting in their mouth. That's the oral stage. It's pleasurable. The next stage is the anal stage, right? They're gaining pleasure by potty training, by gaining control over their excretions. Then there's the phallic stage, where they are interested in their, sexual organs, maybe touching with them, playing with them, exploring them. Then they reach this latency period where they're just not interested in any of these things. And this lasts until puberty. And then puberty is Freud's genital period. Now, for Freud, there's consequences of what he calls fixation. So if you don't successfully make it through these periods, something negative is going to happen, right, in terms of your development. So for Freud, somebody stuck in the oral phase who isn't able to kind of get through there or successfully get through there might be a gum chewer, a smoker, they prefer oral sex, whatever it is. If so, any of these things, if you have them, Freud would diagnose you as orally fixated, or have some problems during your oral period of psychosexual development. I mean, it's fine. It's an interesting description, but how do you even measure this? You look at children and you see like, oh, that kid, they're putting things in their mouths too long. Let's track them as adults and see if they chew gum. No, that's not how it works, and it's no. The anal fixation, right? And here's the thing. The phrases like this, so even though a lot of, most modern psychologists kind of dismiss Freudian ideas, they're part of our culture. You've heard people say oral fixation. You've heard people say anal in referring to like someone who's like super organized, right? But in terms of Freud's analyses, an anal fixation, an anal person could be either organized or messy and defiant. Like he kind of has it both ways, which really reduces, I think, the logic of it. Phallic, right? You've heard of the Oedipus complex or the Electra complex, the desire to kill one parent and marry the other, right? So a little boy, according to Freud, wants to kill his father and marry his mother. This is the Oedipus complex. The little boy is also afraid that his father is going to find out and cut off his penis or castrate him. The very common fantasy. Although I will remind you, Freud's ideas tell us very likely more about Freud than about little boys and girls. And then we look at the latency. If you're stuck here, your lack of sexual fulfillment. Freud might describe someone who is asexual as, stuck in this phase. And then the genital stage, someone who is frigid or impotent, wasn't able to successfully complete this. And again, these are not anything that I would ascribe to. It's just a historical idea of an early stage theory to describe personality characteristics through development. Freud would also say, and look at the oral dependent, oral aggressive, anal retentive, anal expulsive, so different types of personalities, how they get pleasure and how they deal with things. And then the phallic personality, the person is selfish or impulsive. And the Oedipus and Electra complexes, as mentioned, right? The castration anxiety for boys, and then for girls, this is one interesting one too. Freud saw a lot of the issues that women had as penis envy. Basically, their problem was they wish they had a penis and they don't, right? So again, that's Freud's view of things, which, let me say again, do not ascribe to, and I don't think very many modern even psychoanalytic therapists put much stock in these ideas. Interesting ideas, laid a lot of groundwork. Now, we don't talk about Adler as much anymore, but Adler's interesting. He was around this during the same time as Freud, and he looked at, instead of kind of Freud's one size fits all, these are the stages and stuff, he saw things as very individual, but he also saw inferiority as a major drive and motivation. So basically, we do things because we feel inferior and we want to compensate for that. He focused on the idea of conscious motives. What do you want? Not these unconscious drives. And he also saw some things like, if you've heard of like the birth order effect, this is related to Adler, and it is not believed or valid, but a lot of people still talk about it like it's a real thing. Like, oh, that's so middle child of you. Like, oh, you're such the baby of the family. No, there are certainly other factors involved that may appear to have an influence, but there isn't any strong modern belief that birth order has a major effect on our personalities. Adler, though, a very interesting and influential individual. More neo-Freudians under the psychoanalytic theory include Jung. I mentioned, the Myers-Briggs comes from Jung's ideas, and one of them is valid. Extroversion and introversion comes from Jung. He believed in these opposites, right? And so he was really the first one to well define these. Extroversion and introversion are major components of personality, and we absolutely see these things, right, as big in basically every personality test. The biggest factor component is extroversion, introversion, where you fall on the scale, right? Extroversion being, are you outgoing? Introversion being, are you not? Basically, we'll get some more descriptive of that. He also had some major influences culturally. Jung was huge during kind of like the the 60s, the 1960s, and kind of a major influence because he broke with Freud and had a much more positive view of humanity, but still had this psychoanalytical background. He described the collective unconscious, archetypes, the idea that you look at religions and cultures and you see these common themes, right? This was taken up by Joseph Campbell, influenced George Lucas. The main characters in like the Star Wars, these are the same kinds of things. If you look at parallels in stories, and people like to do that, they're like, oh look, Avatar and Fern Gully, and it's all the same story, it's all the same stuff. Well, yes, because this is a standard kind of hero going on a journey type thing. However, when you look outside of the Western kind of literature and mythology, it's a little harder to really kind of fit this in. Jung also talked about the anima and animus, which is the feminine version for a male mind, or the feminine parts of a male mind, or in the masculine parts of a female mind, and how we're balancing these different components. Cool ideas, but again, just really that, and how useful are these things in modern therapy or even understanding the mind. We've really come quite far away from it. The same way, Karen Horney, very good ideas. This focus on becoming healthy rather than exploring the childhood dysfunction, right? So Freud might just stay focused on all the issues of childhood, where others like Karen Horney would be like, all right, what do we do with that? How do we get past it? Saw the cultural influences on personality traits, which is also very useful, and looked at coping strategies, right, which can all be useful, and it just depends on how we do them. When you're stressed, right, do you move towards, against, or away from people, right? So very descriptive, very interesting. But then we kind of get away from the Freudians and the Neo-Freudians. And we've seen before how behaviorism had a major influence on American psychology in the 20th century. And we saw Skinner looking at the environment as responsible for all behavior, right? So we would develop these response tendencies through conditioning, which we could then unlearn or learn other strategies through conditioning, right? Personality continues to develop, and we have all these different life experiences. Remember, the behaviorists were very neutral in human nature, right? Freud saw people as just the worst. We're terrible, and society is keeping us from horrific things. And even then, he saw horrific things in his lifetime, including the Holocaust and the rise of Nazism, right? The Skinner and the behaviorists were much more neutral. We look at things like social learning theory. Here's Bandura from the Bobo doll study. And you talk about observational learning, reciprocal determination. The individual and the environment influence each other. As a young child, you are influencing your environment through your behavior. Are you defiant? How far do you push boundaries? Are you compliant? Things like to define self-efficacy. How do we learn self-efficacy, our ability to reach our goals, right? Those of you who have high self-efficacy, who have a high belief in your ability to set and achieve your goals, are going to achieve your goals more likely, are going to probably perform better in classes and other areas of performance because of this high self-efficacy. Self-regulation is our monitoring of our own behavior. Then we get into humanistic theory. And humanistic theory, we've talked before about like Maslow, but here you see this very positive view of humanity, right? So we start with this idea of this inner force, this inner directedness that makes us want to be the best that we can be. Carl Rogers described the self-concept. How do we define ourselves? And how we have this ideal self versus our real self. So you have who you are and you have who you want to be. And we work towards that ideal self through our drives. Humanistic theory was also influenced. There was also kind of existential psychology in this period too, influenced by people like Rollo May, and kind of an in-between where you had Viktor Frankl, who was the one who survived the most horrific concentration camp torture under the Nazi Holocaust, and yet still came out with a positive view of humanity in general. This very interesting view of the humanists, right? That humans have these positive drives and to survive. When we look at how these fit together, the humanists and the psychoanalytic schools both saw the unconscious drives as a powerful motivator. Social learning, the behaviorists don't care about the unconscious drives. They all believe that we learn about morality from others, but when you look at the underlying belief in humanity, that's where we really see these differences, right? The psychoanalyst, analytic people, Freud, saw people as inherently evil and selfish, viewing anti-Semitism and the rise of the Nazis. The social learning people saw it as neutral, and the humanists came out the other side, saw the success of the Allied forces against the Nazis, and saw this, the good, kind of like good defeats evil, people are good. So one of the most important things to understand as a student for yourself when we're looking at various theories and views of humanity, we have to accept and understand that the time period matters. The influence on people, right, is the time. Where are we now? What are our influences? Well, society for each of these has different effects, right? For psychoanalytic, people are bad, society teaches us to be good. For social learning, there's both positive and negative influences. And for humanistic, society conflicts with our positive drive, back towards kind of like Rousseau's ideas, And we also have, and this is, if we look at how we influence and how society influences us from the very beginning, we have these influences very early on, right? So, for instance, babies can be easy, difficult, or slow to warm up, right? An easy baby is going to be very pleasant, is going to start sleeping. Difficult babies are going to be off cycle, make it more difficult for their parents to get rest or predict their behavior. These things are going to influence time and behavior. When you look at the dimensions of temperament and adult personality, right, you see reactivity. How do we respond to new or changing stimuli? And then self-regulation, which is our ability to control our responses. You can predict in infants, right, how adults will be in some very basic regards, right? Reactivity, self-regulation. Now I'm going to show you some pictures and ask you, let's put on our old psychoanalyst hats. Like, tell me what you think. What do you see? What do you see when you look at this picture? So think about this. What does this image mean to you? What does it look like to you? Here's another one. What do you see? What does this mean to you? Well, if you probably guessed what these are from, these are actually images from the Rorschach test, right? And these are, he basically took a bunch of ink blots and picked what he thought were the best ones in order to describe personality based on a game. Apparently the 19th century, the 1800s, was really boring, and they would, do things like their fun games were like looking at pictures and telling me what you see, or discussing their dreams and what they meant. So when you, again, looking at the, Freud's influence of the dream stuff, that's the history there. By 1939, Rorschach's test was used to assess personality, and yet it is not valid. The only thing it helps to diagnose is severe thought disorders, right? And so when you look at these severe thought disorders, that's usually pretty easy to diagnose in other ways. Now, people still use the Rorschach test. For instance, I was told by someone who does assessments for the courts, sometimes they make you do 3 different personality tests. So they'll kind of throw in the Rorschach at the end, just kind of like as a whatever, because it's easy and fast. And there's only so many good personality tests that are really going to give you information. Generally, we shouldn't be using these things, because, again, of the validity issue. Now, that test that we took earlier is from the 5-factor personality model, also called the Big Five. If you were to give people hundreds or thousands of questions about personality, likes, dislikes, behavior, if you do a factor analysis and you look at kind of how you can group questions together that will predict your answer to other questions. Basically, if you ask people about questions about liking parties and being outgoing, they should answer the same way to all those questions, right? If you ask people questions about being neat or planning, same thing. So they looked at, if you give people these huge number of questions and you run an analysis on them, you find 5 major components. And that's really how this was put together. I mean, it was very empirical, not like, oh, I think that, men are afraid of losing their penis and women want a penis, and therefore I'm going to create a personality theory. No, they actually looked at data and came up with it. So here is the information from the test you took. And now what we can do is we can look at the test itself. So go ahead and look at the scores, and you see like these, there's only a couple that have reversed scores, and that's going to be numbers 7 and 9. And so what we're looking at here is how we respond. So what you're going to do is add these things, basically pick the numbers, and for the numbers 1 through 10, questions 1 through 10, pick the number that goes with your answer, and you can pause it now and do that, and I'll go on to the next slide, which is adding these things together. And these are the 5 traits assessed in the 5-factor personality measure: extroversion, neuroticism, conscientiousness, agreeableness, and openness. So extroversion is, you add questions 1 and 6 together, neuroticism 5 and 10, and your possible scores are between 2 and 10 for each of these measures. So it just basically tells you, are you high, low, or in the middle for each of these traits. Extroversion is, well, are you outgoing? Do you like parties and meeting people, or do you prefer to be by yourself or with small groups or people you know? Neuroticism is your tendency to worry, or to be depressed, be concerned, be thinking about how you are. Conscientiousness is, are you a person who's on time? Are you a person who follows through with commitments? Do you tend to be neat, prepared, clean, or, not? Agreeableness is, how will you get along with people? Do you have a pleasant or a grating type, personality in terms of being argumentative? Openness is your willingness to try new things and new experiences. And so, for instance, You might have, artistic people scoring higher on openness. Now, to be even more useful, we don't want to just be descriptive. We also want to be predictive. And absolutely, this is. People who have what's called high neuroticism are less likely to be happy and more likely to have psychiatric disorders. People who have high conscientiousness are more likely to have good nutrition, exercise, and take care of their health. When we look at the five-factor theory, we have these five components, and this is from McCrae and Costa, extremely valid. And when you think about, I would absolutely use this and trust this. Now, there's some interesting things to look at. So remember, we've talked about mindset and kind of like, do you have this fixed or growth mindset, right? Do you believe that you can learn new things and be successful, or do you think that what you know is what you know and you're kind of stuck there? Well, locus of control is a precursor of mindset, right? It means something similar. It's basically, do you feel you have control over outcomes and your environment, or do you feel stuck and as if you are just kind of trapped? Your opportunities are minimal, you can do what you do, and that's kind of it. The MMPI-2 is a major measure with multiple subscales, highly used for major personality tests. People who want to be, for instance, police officers are also often given this test, and it will have sub measures of, honesty, psychopathy, things where you're kind of looking at, are they lying? Because you hopefully want people who are going to be honest. However, because it's so widely used, there are very frequently published ways to, quote, beat it. So a psychopath who wants to do something that can be, used badly can do that. One of the most well-known personality tests, the Myers-Briggs, is completely nonsense. Extroversion, introversion is sure, but the other things don't really make a lot of sense, and there's no data really to back up any validity there. You might as well take a test on a social media site to tell you which Hogwarts house you're in, or whether you're Team Edward or Team the other guy, because seriously, they're just as valid. Widely popular, they use them all the time. But just because something's popular doesn't mean that the science behind it is useful. When we look at now personality disorders, we're getting into this kind of DSM-5, which tells us, okay, we're describing things in a certain way. Now, personality disorders are different from kind of mood disorders, right? So there's some overlap. So, for instance, paranoid personality disorder is somebody who is just a little more paranoid than is typical, not to the level of maybe being, like a schizophrenic hallucination delusion, but they're worried, they're extra worried that people are looking at them, talking about them. We look at schizoid and schizotypal, which are kind of seen as like if you have both of these, you have a lot of the schizophrenia symptoms, but separately, it's more personality issues. Personality disorders are not necessarily as disruptive, and that's the big thing. They affect our relationships, but people can usually function, right? So someone who is schizoid, who doesn't want to be around people, who prefers isolation and doesn't like relationships, might describe them as aloof. If this person has a job working as like a night security or a forest ranger or maybe a coder who doesn't work with people, they're perfectly fine, right? They might not have a problem with that until they're like, hey, why can't I have relationships and seek treatment, right? Schizotypal is a little different. They may want relationships, but be isolated because they have unusual preoccupations, fears, beliefs, and some disturbances in thought patterns. They might dress atypically, or behave atypically. Antisocial personality disorder is what we would traditionally refer to as a psychopath or a sociopath. So this is interesting. Psychopath and sociopath are generally used interchangeably. We often think of them differently in terms of whether or not they're successful. You can have a successful psychopath or an unsuccessful psychopath, where a successful psychopath is able to fake good and hide their lack of empathy and be successful, where an unsuccessful psychopath may be acting out more on their impulses and more likely to be in prison. But antisocial personality disorder, if you ask people, oh, what does it mean to be antisocial? They're like, oh, I don't like people. And it's no, that's not what it means. Antisocial personality disorder means you are against society, anti-social, anti-society. And so these are people who are more likely to cheat or steal or assault. Okay. Now, we also see, now this is, again, very problematic. Other disorders are things like borderline personality disorder, which is not uncommon, can affect 1 to 2% of the population, and is characterized by extreme mood swings. Really interesting about borderline personality disorder is it is often associated with, almost like bipolar, but faster. Someone can go from, a positive mood to a negative mood very, very quickly. And also they have huge problems with relationships. The classic here is, I hate you, don't leave me. That kind of attitude. Histrionic is another interesting one where you have people who are they love attention, they love to be looked at. Narcissistic is probably something we are familiar with. A narcissist just loves themselves to the point of dismissing other people's ideas, validity. They're not really good at empathy because they have a hard time seeing past their own desires. Then you have people who are avoidant, where they avoid conflict so much they isolate themselves, right? They just don't want to deal. Dependent, which is related to being codependent, but it's basically these people are very dependent on other people for their well-being, and may be afraid to leave a relationship that's extremely unhealthy because of this dependence. And then interestingly, obsessive compulsive personality disorder, which is different from the major mood anxiety disorder, because with obsessive compulsive personality disorder, it's like a lower level of the anxiety disorder, right? Where it's a little bit more able to be handled. Now, what's really interesting about personality disorders is this. I side with this too. Researchers are not convinced that all personality disorders are in the same class. For instance, borderline is argued by some to belong in the bipolar category. In fact, when you consider what's called inter-rater reliability, which means, and here's the biggest problem with personality disorders, mood disorders, anxiety disorders, much clearer. Personality disorders, if you were to take, someone with a personality disorder and have them have a bunch of therapists or diagnosticians analyze them, they're not going to agree on the diagnosis, except for borderline personality disorder, right? So that makes it kind of like, how valid is this? And it's always been a debate whenever they come up with a new version of the DSM, the Diagnostic and Statistical Manual, basically for diagnosing in psychology, is how valid are these? But they do agree, and they do kind of put them in, even though it's problematic, right? So if you were to take people and have a bunch of, clinicians diagnose them, the disagreement means that it's tough to say this is valid. Other things, for instance, histrionic personality disorder is often common in highly successful people. Look at your social media stars, who are like, oh, look at me, and doing all these things very dramatically, right? Well, if you're successful, is it a disorder? If it's working for you, is it really a problem? So that's what it comes to in the debate about the disorders and the validity. Why would you have that? So this is a good place to kind of end the discussion and say it's not entirely clear, what the issues and validity are here. But it is interesting to consider some, what we need to know what personality disorders are and how to understand them. All right. So thank you. I hope you've enjoyed our discussion of personality, and I look forward to our future discussions.